Alrighty, Marky, the floor is yours.
Thank you very much. I'll get to my share here. But the first exciting thing that we have is we're changing our name. We are now Aging and Adult Services of Coastal Washington. So this is a better reflection of the counties that we serve. Clallam, Jefferson, Pacific, and Grays Harbor. So not really coastal when you're down, or you're, excuse me, you are coastal, but you're not Olympic necessarily when you're down in Long Beach. So that's we've got new name, we've got a new number, central number, all kinds of exciting things. We are excited with our lovely new logo, which also is a better representation of our agencies. So, what are area agencies on aging? So, the federal legislation, Older Americans Act that was passed in 1965, created AAAs across the country. We're government-based community organizations designated by DSHS under authority of the Older Americans Act to administer the aging network of supports and services for older adults. There are 13 of us across Washington state providing no wrong door services, which are often branded as community living connections. Um, every county has a AAA. We all have different varying names, but there is one in every county. So, Aging and Adult Services of Coastal Washington, we were started in 1976 as we started with the Olympic Area Agency on Aging, otherwise known as O3A. We do cover Clallam, Grays Harbor, Jefferson, and Pacific counties. We have 6 direct service offices: Long Beach, Raymond, Aberdeen, Forks, Sequim, and Port Townsend. And our admin office is also located in Port Townsend. So we do provide some contracted services such as senior nutrition, both congregate and home delivered meals. We contract for the Senior Farmers Market Nutrition Program, senior transportation. We have some evidence-based wellness programs, a wide range of Medicaid services for long-term care clients. We also have an LEQ companion robot pilot project. Very interesting one there. And we do provide some one-time emergency assistance for minor home repair and senior emergency funds. And we'll get into a little bit more of some of these. Our senior nutrition, we contract with providers for congregate and home delivered meal programs, enhancing food security and nutrition, currently with Coastal Community Action. And we have the Senior Farmers Market Nutrition Program where folks can get $80 to spend on fresh produce, either at farmers markets or if they are unable to access the farmers markets, bulk produce. We have contract services with different agencies, Catholic Community Services, as well as Coastal Community Action to provide medical transportation to those who don't have Medicaid and paratransit services. We also have our direct services, and this is more of my area. We have a caregiver support, we have Aging and Disability Resource Center, Dementia Outreach Project, Medicaid in-home care, statewide health insurance. Oop, forgot the B in that one, benefit advisors, care transitions, the Walk Cares Fund, and health-related social needs, or HRSN. So our caregiver support, we have our family caregiver support program, local resources services training, access to respite care, kinship caregiver support program, and relatives as parents, which provide resources, connection, and potential financial assistance with one-time costs for those raising a relative's child. We have the Kinship Navigator program where you can have help navigating resources for those raising someone else's child and not formally in the foster system or other state systems. Aging and Disability Resource Center, which many of you may know as Senior Information and Assistance, another name change. But that current ADRC programs include the care transitions, HRSN services, our Walk Cares beneficiary services, general information referral, and assistance with program access. So this is my area, my programs that I oversee and the staff that I oversee. Our ADRC specialists provide options counseling to older adults, people with disabilities, and their families, unbiased information, guidance, and access to long-term services and supports. empowering individuals to remain independent, safe, and healthy in their homes and communities. We do have our dementia outreach project, multiple things happening here. We have our community education, 1 hour informational sessions on becoming more aware, empathetic, and helpful to those living with dementia in your local communities. Offered to businesses, small groups, families, schools, and more. That's a fabulous training. I've taken that one myself, and it was very enlightening to kind of understand a lot more about dementia. We have a SHARE program, which engages the person with early stage dementia and their care partners in planning for the future through discussions about symptoms, care values and preferences, as well as healthy activities. STAR-C, individual sessions with a coach to help caregivers decrease problem behaviors in the person with dementia and address their own responses. Caregiver training, dealing with dementia workshops, which are free small group family caregiver trainings, and options counseling, free consultation regarding local options and resources for family caregiver and people who are living with dementia. We have our Medicaid in-home care, our case management, which is assisting adults who require help at home with activities of daily living, such as bathing, dressing, transferring, qualify both financially and in terms of the need for Medicaid in-home care programs, utilizing those services in a safe and effective manner. We also have health homes to support those with complex healthcare issues, access and coordinate care while gradually achieving their own life healthcare goals. We have our statewide health insurance benefit advisors or SHIBA programs. So we have our SHIBA volunteers are highly trained. They attend multiple trainings constantly, continuing education to be able to provide free, unbiased, confidential counseling to individuals on Medicare and related health insurance options. Designed to help people make informed decisions about their healthcare coverage. A big one, most folks know that they're available during open enrollment, but they are actually available all year round. And we do have multiple events in both Clallam and Jefferson counties with drop-in sessions. So those are also on our agency community calendar and flyers out and about all over. And it is a service through the Washington State of the Office of Insurance Commissioner. And that's where training comes from, and a lot of our support and our contracting comes from OIC. We have our Care Transitions program, and this one's not a widely known program. Folks are referred through their primary care providers, and we do have MOUs with our local hospitals. It is short-term support for those who've recently hospitalized, helps them to transition from the hospital back home and help manage their care. We do a home visit, we do follow-up calls, assist them in understanding their discharge plan and as well as medication requirements. Often when people are discharging from the hospital, they just want to go home. They may not be paying too close attention to what their discharge plans are. So we go over that with them as well as with the social workers and the folks at the hospital. So that's a great program. We also provide a individualized client assessment, includes the social determinants of health. We can help apply for any assistance programs, either internal programs that we have here at Aging and Adult Services or programs across the state. Energy assistance is a big one. You know, we have our LIHEAP program, and we love to make sure to refer folks to that and any other agencies that may be beneficial based on their assessments. The goal is to prevent the need for rehospitalization. We do have some one-time emergency assistance, very limited, but we can provide some minor home repairs and emergency funding available for adults 60 plus. We can do home modifications, repairs, stairs, handrails, grab bars, help with ramps. assistive devices, utility payments, minor car repair, just a few. We often reach out to other agencies to see who else can help provide some of that assistance. A lot of times, we're getting folks who are like, "Hey, I have a car repair that's $1,200." That's a lot to cover, and so we try to work with other agencies, including OLICAP or St. Vincent de Paul's, different agencies to kind of help pull that together. We do have the Walk Harris Fund, which is a long-term care fund that most Washington workers have been paying into since July of 2023. These are earned benefits that are available July 1st for those who've met the contribution requirements and have qualifying long-term care needs. These benefits are flexible and can be used to pay for in-home caregivers, home safety modifications, assistive devices, home delivered meals, and much more. Near and recent retirees can earn a partial benefit. So if they have worked at any point in the last 3 years, they may qualify for benefits. So I originally had planned to do our health-related social needs presentation, and I realized that there's just not enough in there to cover a full hour. So you did get the broad overview as well, and then I'll go a little bit more in depth on our HRSN services. It is a fairly new program, and we're just trying to get more referrals into the program. So our health-related social needs services is under the Medicaid Transformation Project 2.0. So these services allow qualifying Apple Health enrollees to receive evidence-based non-medical services such as accessible and sustainable housing, nutrition programs, and caregiver support aimed at supporting individual health outcomes. These services are available until June 30th of 2028. Healthcare authorities leveraging and funding AAAs to stand up select HRSN services through existing community living connections and provider networks. Aging and Adult Services of Coastal Washington, we're doing outreach, screening, assessment eligibility determination, person-centered care planning, authorization, and payment for our HRSN services. To qualify for these services, they must be enrolled in Apple Health, Medicaid. They meet at least one clinical risk factor criteria for the specific HRSN service and meet at least one social risk factor. And we can go over a little bit more of this with each service. So currently we have our nutrition supports. So we have contractors available to provide these services. We have our medically tailored meals, tailored to support individuals with health-related conditions that with these medically tailored meals that would improve their health outcomes. Nutrition counseling education, kind of straightforward there, but designed to motivate and facilitate voluntary adoption of food choices and other food and nutrition related behaviors conducive to health and well-being. Pantry stocking is available for those under 21 or pregnant, and they can get an assortment of foods aimed at promoting improved nutrition from retailers or have food delivered to their home. Same concept with fruit and vegetable provisions, where folks are able to access fresh, frozen, canned fruits and vegetables from retailers and farms or have, again, food delivered to their homes. We have our home accessibility remediation and adaptation services. We're still gaining some contractors and providers for this program, so we're hoping that we have these available soon. But these provide physical changes to a home necessary to address health, welfare, and safety of an individual or enable the individual to function with greater independence in the home. Ramps, bathroom modifications, door widening, air conditioners, air purifiers, refrigeration units, home generators, grab bars, mold or pest eradication, and hoarding cleanup, which we are all excited to hear about because there's not a lot of folks that are able to provide that service. We have our caregiver respite services, again, coming soon, which is available to members with an unpaid family caregiver. They can get up to 336 hours of services per calendar year, includes in-home and in-facility services. And referrals. So this one is a good time. We're still working through this. We do have, I've mentioned it multiple times, Washington State Community Living Connections, and I'm not sure if any of you have ever visited that website, but I think that I strongly encourage you to do so. It's basically our AAA's referrals, providers, and um, it's a resource directory. That's what I meant to say. So we maintain locally for our four counties, and the state also maintains the referrals within this system. So there is a spot in there that you can just refer a patient, and it has some very basic information on who's referring the client, why are you referring the client, what are your concerns. We're working on I have a referral form I will send out to you all. It kind of needs a little bit of updating and some new information on there, but it will eventually live on our website under HRSN services. So I will definitely keep you all posted. I will show you um, real quick. It really is a very basic form, and it is kind of one of those ones that lets you know a little more what we're looking for folks. And hang on, eventually I'll get it where it needs to live. Okay, so it's very, again, basic. And this one we currently have for nutrition supports, and that's what we're updating is adding in the home modifications and adding in the other services. So there's one referral form available for all services. And we are asking for basic information on the participant, address, city, zip, date of birth, how old they are, number in the household. If it's known, their Washington Apple Health ID, who's referring them, numbers. So for our nutrition supports, the obviously requirement is that they are enrolled in Apple Health on Medicaid. If they are looking for pantry stocking services, they need to be 21 or under or pregnant. They also need to have a chronic health condition. This is the big one. I've been receiving referrals that are asking if they have a chronic health condition. They're saying no, they don't. And then also, have they been discharged from the following settings? So for medically tailored meals, they need to have been discharged, I think, within 6 months for need of that. And then another one for nutrition services, they need to show their food insecurity. And so that's where the questions come in about basic food insecurity here, worried about their food running out or any of those. And so it does list our types of the services available um, up to 6 months for, I think it's about $80 a month for fruit and vegetable incentive provisions, medically tailored meals. They can get 3 meals a day, 7 days a week, up to 6 months. Pantry stocking, there's a price range on that. I don't remember what that is, unfortunately. Sorry. Nutrition counseling and education. And so then you would fill this form out and then either email or fax it to the information provided below. Very basic referral form. The Washington State Community Living Connections, there's a spot on here, and I'll just see if I can get there real quick, like from my actual link. Let's see. Yes. So if you do go to the Washington State Community Living Connections, there's a spot where you can refer a patient. And I had talked about this earlier, but it's even more basic. It was not necessarily designed for these services, but right now, until we refine our referral process, this works. Provider name, I know hospital, clinic, agency, your number, your email, patient's information, again, real basic, alternate contacts if there are one, and then here, and you can refer folks over for any of our programs through this portal. Basically, what happens is I get the referral, and then I will send that referral out to whichever program or person who it needs to go to. So if you have somebody that you're concerned with dementia, I will then send this over to the dementia programs. So it just basically calls any comments are helpful. It is asking if this is a care transitions referral, yes, no, permission to release the information. So that is the online version. And I will just go and kind of show you a little bit of this website. Find providers and resources. Great. More information on Washington Cares, the providers available there. So here's just information on the network, different partners, service options, and things of that nature. So it's a very helpful website. I know you all have your own referral registry, right? Or resource directory, correct? Yeah. So a lot of duplication, but that's okay. So that's kind of what I've got going on. And now I'm going to stop sharing my screen and answer as many of your questions as I can possibly answer.
Thanks, Marky. So I I saw Molly first. I don't know if you still have a question, Molly. And then Corey, you came in a little late, so just want to acknowledge that you'll go second.
Oh, thank you. It was about the one-time emergency
Mm.
assistance.
Mhm.
Would that go through that same referral system you were just talking about, or is that a different, like how could we refer someone to that?
That one, you could use that same process, or I suggest just calling your local office and connecting with the ADRC specialist in that office, and they will help with that process.
The ADRC, is that what you said?
Yes.
Okay,
So my staff are called, so we have our Aging and Disability Resource Center, and so my staff are ADRC specialists who are specialized in that area. They're the ones who will do that options counseling for folks and help people access different programs as needed.
great. Thanks for clarifying.
Of course.
Corey, did you have a question?
I did, thank you. I just had a question on some of the health-related social needs programs that are, I think you said they're coming up, but the eligibility for those, like the nutrition assistance and everything, is that exclusively for individuals, adults, or like if there's someone who has a child with special needs who needs nutrition support and they're a caregiver, would they be eligible for those like caregiver respite programs or the nutrition programs or whatever?
Yes. So we currently have our nutrition programs are up and running. We are working with two providers for that, Mom's Meals and GA services, food services. So that's basically a box of food that would be sent. If they are on Washington Apple Health and have a chronic condition and are nutritionally insecure, then they may be eligible. We take these referrals that are sent and then we do a much more robust eligibility process, but this kind of gets them into that. So yes, some of those options are available for those who are under the age of 18. And yeah. And also if a parent has a chronic illness, food insecurity, and also has a child in the home, they may both qualify for that service.
Thank you.
You bet. Good question.
I had a question as well, Marky, and I'm sorry if you answered this and I just missed it. But when you were going through the application process and you were talking about the different criterias, you mentioned the chronic health and food insecurity. What is the verification process for? Is that like self-attestation or is that the provider has to, yeah, just curious what that looks like.
Self-attestation on both chronic illness as well as food insecurity. There are certain we do go in and check to see if they're eligible through different systems. So there are certain, and don't forgive me for not knowing what RAC codes, what the RAC stands for. We're still learning that bit. That's new for my staff. That's been happening a lot for years through long-term support services, and so it's a little new for us. There's certain eligible codes and ineligible. So if we pop them up in provider one and they have an ineligible RAC code, then they're just automatically ineligible. And we do send out letters and let them know that they're not eligible for the program, or if they are eligible for the program, and just kind of let them know they're not eligible. So.
Helpful. Are there any other questions that are coming up for Marky?
And you can always reach out to me. I kind of took that slide down, but might have my email listed somewhere. And I will also update that referral form and get it over your way. Would it be best to send it to you, Yuan, for distribution?
That's great. I can send this out to the team.
Okay, great.
Dawn, Ellie, anything coming to mind?
No, I just have to say, every time I deal with the staff over at our local organization, they are wonderful, very helpful.
Great. I'm happy to hear that. And we are doing our care transitions program with y'all. So that's lovely
Nice.
to get those referrals and work with folks. We've been doing with Olympic Medical for the last year, and we've gotten to the point where we have someone, every Tuesday he's there and he's meeting with patients before discharge, and it's just been a really lovely way to work through that program. Yeah. So I'm
Awesome.
excited to continue building it with Jefferson Healthcare.
Awesome. Well, Marky, this was super helpful. I loved your slides. I feel like you answered all the questions as you went. So I feel like that's probably why we don't have a ton, because you did a great job presenting. For you all, I'm gonna be this was recorded, so this will be added to our YouTube channel, and if you want to share this with your peers, for those who weren't able to make it, that would be, helpful. But otherwise, that's all we've got today. I appreciate everyone's time, and we'll see y'all next time.
Thank you all for coming. I appreciate you being here.
Thank you.
Bye, everyone.
Have a good rest of your day.